5 important things or parameters which we have to look and assess in each and every patient before planning the hair transplant of that patient. So let's dive deep into the scientific way and the reasons and the assessments which we as a hair transplant surgeon do for every patient of hair transplant. Friends, I am Dr. Satya Saraswat. I am a plastic and a cosmetic surgeon, a gold medalist one, and also member of International Society of Hair Restoration Surgery, American Board of Hair Restoration Surgery, International Hair Restoration Surgery Society, Indian Hair Restoration Society, as well as fellow of ISHRS as well. So today I am going to break down how I evaluate all my hair transplant patients. So please keep watching this video till the end, and to know and see such more useful videos, I request you to subscribe to our channel. So the first and the foremost important point is the age of a patient and the hair loss pattern at which they are currently facing the hair loss. Also, in adjunct to that, I always ask them about their parental hair loss. If there is a hair loss and if it is either on the father side or on their mother side, I always ask them what is the maximum degree of hair loss he has in any of his known relative. That gives us an idea to which grade this patient can progress. We may have a patient who is currently, say, grade 3, a 25-year-old guy with grade 3 hair loss, but his father is a grade 7. This gives us an indication that his hair loss may progress to a much greater degree in future, and also for the time for which he is having hair loss. Suppose a patient of 25 years having a hair loss for just 2 years and is now almost a grade 5, which means a very rapidly progressing hair loss is happening here. In these kind of patients, we have to be very conservative in our hairline planning, because if you reach up to grade 7, we have to preserve the donor side to the maximum, and if this patient needs more transplant in future, and if we do a very low hair transplant in the first sitting itself and very high density, very low, and trying to give what he has lost in this endeavor, in future if he has a very aggressive hair loss, he may be left with a very low hairline in the front, slightly dense, but a bald patch in the back and in the sides also. Now we are seeing a lot of such patients who underwent hair transplant at a clinic like 5-10 years back, underwent a very aggressive hair loss. For a grade 3, around 4,500 grafts were used, and now he is grade 7 and there's hardly anything left in the donor side. So proper planning needs to have a knowledge about the previous hair loss and the future to which it can progress. If you also want to know about the customized hairline you should be having, please mention the age, your grade of baldness, and the kind of hairline you like at the time of hair transplant. So once we have looked at this pattern, then we do a trichoscopy, and this is to analyze the donor site. Extremely important, my friends, because donor site is limited. Safe donor area has limited number of grafts. This can vary from 3,000 to 7,000 or 8,000 grafts also, which can be taken out. The donor site can have from 6 to 8,000 grafts up to 20,000 grafts also in some patients. We have seen some patients with extremely good donor site, and this gives us an idea about how many grafts we can take out by FUE or FUT, and then we match it with the hair loss pattern and how many we can take out, what density we can achieve. Then we measure the recipient area or the bald area. Along with this, we assess the density of the follicular units in the donor site, the thickness, anagen is to catagen hair ratio, a terminal is to vellus hair ratio, what's the total dimension of the safe donor area, and ultimately how to place these 1 hair, 2 hair, 3 hair, 4 hair grafts in a very proper way. So friends, it's not absolutely essential that a very high density transplant is going to translate to a very good result. Sometimes it may be paradoxically opposite of this also, because high density does not mean in itself that you are going to have better result, because there is a relative scarcity of the oxygen in the blood flow if too many grafts are placed in a very smaller area. Please like this video if you're liking the content till now. The third point is where we have a detailed discussion with the patient about the hairline and their expectation. Many patients, they come with celebrity hairlines, and we have to give them a reality check. A very low, very aggressive hairline, as we have discussed, may not look very natural for you. So to let them know, we draw a hairline for them on the iPad and show it to them on the screen. We show them future hair loss which can happen and how low hairline is going to look very unnatural. If you want to see how your hair transplant is going to look like, we have an app by the name of Saraswat Hospital. It's an AI, artificial intelligence app, where you can see the future prediction of your results after the hair transplant. It gives you the number of grafts, the cost, and a few questions which you should be asking your patient also. If you want to plan your hair transplant with us, we request you to share your your information on WhatsApp or call us on the numbers mentioned on the screen here. Then the point number 4 which we talk about is the lifestyle of a patient and the medical conditions if they have. Many patients are now suffering from problems like diabetes, blood pressure at a very early age. So all these medical problems and a lot of others are also there. They can hamper with the blood supply in the transplanted area. Diabetes leads to poor blood supply. There's a microvascular damage. Similar things can happen with many other patients also. So we discuss this. If there are such problems, then we try to undergo a limited or a conservative hair transplant. We had a patient from US around 7 months back. His diabetes was extremely high. He was just in his late 20s and his HbA1c was more than 13. So we controlled it. He underwent a slightly low density transplant in the frontal tuft area. You can see his before and after pictures. We did a very conservative transplant in this patient, and you can yourself see the difference here in the results. Also, we asked them about their sleep, their lifestyle, their stress levels, how stressful they are, and all these things do help us in deciding the future course of action after the transplant. Friends, sometimes unfortunately we have to say no also to our patient because a hair transplant per se may be dangerous or not safe for a particular patient looking at the medical conditions of that patient. And the last point is the long-term commitment which we see in a patient. We see what's their aftercare mindset. A person who is saying I cannot take medicines for a long time is a no for us, and this is something we talk about. We give them a reality check about the expectations they should be having from this hair transplant. Hair transplant needs to be taken care by the patient themselves. It's not a very quick magical solution like a patch. It's a natural solution, and the final outcome of a hair transplant may vary from 12 to 18 months post-operatively. So it's not a very quick fix solution. It needs medication and aftercare, PRP sometimes, and follow-ups with us. A sort of a close rapport is built up with all our patients. It's just like hitting a gym. You need to be very, very consistent with what we're telling you to do to get the best out of it. Sometimes need finasteride or a minoxidil and finasteride lotion, PRPs, and follow up with us. If you think this video has been useful to you, please share it with someone who may find some value in it. If you want to know the hair transplant full process step-by-step guide, please click the video on the left. And if you want to know the factors on which the cost of hair transplant depends, please click the video on the right. Thank you.